Single-payer healthcare. It's a term I'm sure you've heard characterized by your leftist friends as the second coming of Christ and by your conservative grandparents as nothing less than totalitarian communism. But what is single-payer healthcare? Is it efficient? Is it less costly than our multi-payer system in the States? So I think it's important to define the terms that we're working with here. And I'll start by talking about the system that we have in America. In the States, we work on something like a hybrid multi-payer system. And the standard really is to get your insurance through a private insurance corporation. Now, private insurance companies essentially function by disseminating the monetary risk of healthcare among a large amount of buyers. Functionally, the way this works is you, the buyer, agree to pay an insurance rate every month as well as a deductible, and you're covered by the company. At this point, if you need medical services and exceed the deductible in costs, the company pays the difference. Single-payer healthcare is just that, a system under which there is a single payer who pays for everyone's healthcare. And in this situation, that single payer would of course be the American public. Under single-payer healthcare, healthcare would be dealt like just like any other social service, like the police, the fire department, or public schools. It would all be paid for by our tax dollars, and there would be no charge at the point of service. With the technical stuff out of the way, we can get into perspective 1. Single-payer reform. Heed the evidence, not the soothsayers. This is an article by David U. Himmelstein. In this article, David goes over the general advantages of universal healthcare, as well as doing his best to debunk the more neoliberal idea that universal healthcare is something of a political pipe dream, and that actually trying to get policy passed would be near impossible. He even doubles down on his confidence in single-payer healthcare, arguing that it is simply not enough to have a reformed multi-payer system or a public option such as Obamacare. As evidence for this, he cites a hospital in Maryland that has not been able to trim down its administrative costs because it still has to bill based on individual payers and patients and procedures. He reasons that if there was a single payer and billing could be done in a more generalized way, it would help hospitals to better trim the fat when it comes to costs, so that they wouldn't have to bill based on individual payers, their rates, as well as individual patients and individual procedures. I plan to use an article called "Healthcare is Not a Right." I don't know, I'm gonna be honest, it really didn't do it for me. Not just that I necessarily disagreed with it, but just because it really didn't, offer much of substance. Its argument was essentially just, universal healthcare is bad because Americans wouldn't be proud of an entitlement. Honestly, there's just not a lot I can do about that because it's really just, kind of an unfalsifiable claim. Like, it was just very, it was just a lot of, appeals to emotion, and like, which is fine, but it just really didn't, it really wasn't the fact-based conservative argument that I wanted to, that I thought was, worthy of putting up against these other perspectives. So, instead of this, we are going to go on to perspective 2.1. 5. The truth about universal health care from a Canadian. So this is a video by a prominent conservative video maker named Steven Crowder. This video is basically, it is 10 years old, and it really should be stated that this video is specifically about the Canadian universal healthcare system, and not just universal healthcare as a whole. This video is, it's an interesting one. It is definitely very much anti-universal healthcare, and that's not really explicitly stated until the end. However, it is heavily implied throughout the video. So the video starts out with Steven Crowder, explaining the situation, explaining the, experiment, I guess, and heading to Canada, getting there, he meets his friend, and then after that they, quickly get into it, and they go to a clinic, which they, they find out is closed on Sundays. There's an ominous scene where a nurse at a hospital tells them, don't get sick on Sundays. So after they, leave the clinic, they go to the hospital, and the whole time they are, basically pretending to have like a sprained wrist, a fairly mild problem that they want to get checked out by a doctor. So they head to a hospital. The hospital, there's a scene that's, again, adding to this pretty dystopian picture, where they get in and they have to take a number, so it doesn't look good. They have to take a number. The waiting room is really crowded. The nurse at the counter seems to be, kind of rude and short with them. Later in the video, at about the 19-minute mark, he gives a more explicit, kind of, he talks about the situation in more explicit terms. He basically reasons that, if it's this hard to get health care, then universal health care is not a good idea for the states. As well as he cites the fact that they were referred to a private physician, and essentially says that if Canada is moving toward our system, why should we be moving toward their system? This paints a bad picture for universal healthcare. It doesn't look good, and even if this video was, really that it was, organized or edited in a way that made it look worse than it was, there are things that you can't fake in this video that really aren't good. I mean, a 2 to 10 hour wait time, the existence of, the rationing of healthcare. It doesn't look good at all. Perspective 3, Dr. Danielle Martin. So this last perspective is really short, and I can really sum it up in this clip.
If people get seriously sick in Canada, they have a heart attack or a cancer diagnosis or whatever, our outcomes are excellent for those serious conditions, and we don't wait any longer than anybody else in the world for those important things. Having said that, we do have a problem with wait times for what we call elective or non-urgent procedures. So people who are waiting to see a specialist for a non-urgent issue, there's no reason why people should have to wait. And what we have determined, those of us who study these issues and work on these issues, is that although those waits are a problem, they are not caused by the fact that our insurance plan is paid for by the government. The reason that we have difficulties with waits is because we have done a poor job of organizing the delivery systems of care.
So essentially, her point is that Canadian healthcare is really plagued with real problems. However, those problems don't necessarily have to be innate to universal healthcare, but could be problems of organization and disbursement. And I think really we can extrapolate her perspective in a way that really makes a good conclusion for this project. During this project, I really have learned a lot more than I expected to. In all honesty, I didn't think that I would come out of this having new thoughts and new feelings about universal healthcare. But I genuinely do. But I think that her perspective is, if we extrapolate it into universal healthcare in general, it's that universal healthcare can be a good thing if it's implemented correctly. And if it's not implemented correctly, it could be plagued with just as many problems as our current healthcare system is. Long wait times, lower quality of care, etc., etc. We see other developed nations with universal healthcare that are doing a lot better than Canada, and I think that's really a good note to conclude on. I think that the conclusion that I've come to via these texts and videos and articles is that universal healthcare is not some, wholly uncritiquable good, and that it can be plagued with problems when implemented poorly, and that the best solution that I can come to from these sources is that universal healthcare should be implemented, but it should be implemented with caution, with expertise, and while paying mind to the shortcomings of other countries who have also implemented universal healthcare. And that will be all for this video. Thank you for watching.